Okay, I have some notes, so I may look down. I have some ideas. So thank you so much. So I'll first just start off with my title is registered counsellor. And one thing about counsellors that I want people to know is that to say you're a counsellor is not a protected title like it is to be a psychologist, meaning anybody can call themselves a counsellor. So I'm very proud to always say I'm a registered counsellor because that means I'm registered with a high level counselling body. I maintain a strict protocol of ethics and ethical practices. I engage in continuous PD and supervision, and there's certain amounts of experience I have to get before I'm able to provide private practice and private insurance rebates as well. So I just want to be particular about that because anyone can call themselves a counsellor. So it's just something to keep in mind. I see individuals and couples. Us couples therapists are a rare breed. I have couples before this and after this. And I mainly see people in their 20s and 30s. Yes, where do I go from there? I actually say that I'm a counsellor for life. And so it's interesting to talk about mental health because I never mention mental health in my website, in my social media, in anything that I talk about, because I prefer to stay in the early intervention, mild to moderate symptoms types of clients. That's where I personally flourish. That's where I enjoy being. And so I am a counsellor for people going through life issues. You do not have to have a mental health diagnosis to receive any support, but it's one of the things that I want people to really know is that you can have a counsellor and access services and you don't have any mental health issues or diagnoses. I love to talk about self-esteem. I think self-esteem is at the root of many, many problems and it's often missed. Where I really flourish is emotional awareness and emotional insight and emotional regulation. Okay, I'm a highly sensitive person. I love teaching women and men about their emotions, understanding them, containing them, expressing them, and making the most of them. And that comes through with individual work as well as couples. Couples will fight about everything except what they're actually upset about. And I love bringing the emotional awareness into why are you arguing for 8 hours about the fact that he came home late? Let's look at the emotional connection underneath that. It's not that he came home late. So that's kind of one of my loves, my passions. And my real goal is whatever you're coming in with, I want to help you find congruence between what you're feeling on the inside and how you're expressing yourself in the outside world. Okay. And vice versa, if your life is causing you stress, anxiety, depression, I want to make it so that the outside world contributes to a better inside world, and that's flowing really nicely. And a big part of that is authenticity as well, knowing who you are, understanding what you want, what you need, and then creating that life so that there's not two people, you're not wearing a mask constantly between who you are on the inside and how you express yourself in the outside world. And with couples, it's communication skills. I always say you've done the hard work by finding that person. Good on you. You've done the chemistry. You've done all that good stuff. Let me teach you the practical things. Just like you need to go to an accountant or you need to go to a personal trainer, couples therapy is the greatest investment you can make. My biggest frustration with couples is that they often come in when they've just separated, or it's an ultimatum that you start couples therapy or this is over and done with. And I need you to help us counsellors out a little bit more and come in 6 months before. I brought many couples back from separation, but really we know from research couples that have even premarital counselling do better in the long term. So please get started before you hit that crisis point and we'll be able to help you a lot more. And we also talk a lot in couples about intimacy, sexuality, managing expectations, and recovering from affairs is often a big topic that couples come into me for. And I think what I love about being a counsellor, and this is the last thing I'll say, is that it does give us a more broad or a bit more permission to be ourselves and to bring in different modalities, experience, and wisdom. It's not so structured by the book that we cannot talk out of turn. I bring a lot of philosophy into my work. I bring a lot of poetry into my work. I bring a lot of different modalities. And I love having that freedom of bringing quality and helpful information that has changed my life in so many ways, and I'm not restricted so much. So you often get more of a sense of a counsellor, I think. And people often say I'm relatable, I'm warm, I build really good relationships. They don't feel like I'm sitting there with a clipboard diagnosing them. Counsellors don't diagnose mental health issues. We most often see people from a person-centered perspective, meaning we see the person first. We don't look at them through the lens of a diagnosis. So if you're ever worried about what notes we're making, none of the notes I make are about diagnosis or making any of those things. That's not what counsellors do, and we don't prescribe medication either. So it's really about you as a person, as an individual. And I think that's probably given a long-winded summary of counsellors. So thank you for bearing with me as I got all my ideas out.
You've done a great job, Gabriella. Thank you so much. And I love that you work so closely with couples, because it is a niche. And it is, I get a lot of people coming to me asking if I work with couples, and I do, but not in a way that a couples counsellor would or a counsellor would. So this is good to know. You're going to get all of my couple clients. That's really important.
Sort, let me tell you.
Yeah.
Hard work, but it's brilliant.
No, I believe you. And I so understand that 99.9% of all of those issues really come down to communication and communicating what it is that you want and need from someone, and not just expecting them to know. So yeah, thank you so much for sharing that. We will move on to the next speaker, but please stick around, because we will be doing a Q&A at the end. Some people are already sending their questions in, which I love. And we will be getting to those just after all of the speakers have spoken, and we will be answering those live, which is going to be great. So thank you so much, Gabriella.
Thank you.
Alrighty, so next we have Kelly Delby. So we love Kelly. Kelly is a holistic practitioner and someone who I know and have known for quite a long time. I first met Kelly when I was absolutely dying in her class. She taught, or you still teach, some mega former exercises. It's Pilates, but very difficult. And that's where I initially met Kelly, and then learnt about all of the amazing things that she was doing. So Kelly, welcome. And could you please talk to us about what services you provide and what kind of people come to see you?
Thank you, Dee. And I'm glad that Gabriella mentioned what she did about counsellors. And as I was listening to you speak, Gabriella, I was thinking, you are someone that I would actually come and speak to. And I think it's really important that everyone understands that we as therapists and practitioners and counsellors might understand concepts and the reason why emotions arise and how to deal with them. That doesn't mean that we're void of experiencing them ourselves. So I think it's really important that each and every one of us has our own mentors or group of people that we turn to for support. So it's really nice to hear you speaking, Gabriella. So what I do as a holistic counsellor and mental health practitioner is there's many names and titles and different things that I weave through my practices, but I predominantly work with girls and women. I do see men on occasion. However, I really feel passionate about working with women from the age of even under 10 all the way through womanhood. And I love seeing young girls come to sessions. Particularly, I love that their parents see the value in then coming to have a mentoring session. And that's essentially how I think of my sessions, as a mentoring session, talking human to human, meeting my clients heart to heart, and just seeing them for all that they are, because holistic just means wholeness. And so what we're looking at in holistic counselling is your mental health, which I describe as your peace of mind and also the stimulation of your mind. We need these two things. So it's really important that we learn to understand the difference between those things and what the mind needs, and also the effect that our behaviors are having on our mind states. So I really love empowering girls, young women particularly, to understand how to navigate their challenging emotions, because all of our emotions are valuable. And if we can learn to meet challenging emotions, particularly anxiety, which I do see a lot of clients surrounding anxiety, we can learn to see that as a communication system from our body. I also integrate mind-body medicine and tapping as part of my therapy tools. And these are really, really powerful, because mind-body medicine, which is a native West Australian native flower therapy, what that does is it helps us to access different parts of our mind. So often we're playing out a particular behavior and it's not necessarily the most helpful for that situation. So what this type of therapy does is help us to reach for a quality or a character trait that would be a little bit more helpful in that situation. I also love drawing. So when I'm describing things to clients, I'm drawing pictures. And the thing that I draw the most, including with a 13-year-old girl that I had here just before, is a pie graph with all the different aspects of us. Because in any situation, especially when you're feeling yucky, if you can go, okay, which part of me is feeling that right now? Okay, it's the part of me that wants to achieve up here. And if I can meet that part with this other part of me that is compassion and go, yeah, it's actually, it's helpful that I want to achieve really well, but I can find some compassion for myself. And you're just starting to call upon these different characteristics, like the movie Inside Out, which I love and reference a lot. It's helpful. And, you know, if you haven't seen the movie Inside Out, I really encourage you to watch it. So I love empowering people to meet these different aspects of themselves. And talk therapy is incredible. It gets us so far. That's where energy medicine and vibrational medicine and things like that, the tapping especially, can help us to overcome where we're stuck, where we're fixated and what we're sort of focusing in on, and remind us that while this is important, all of this is also still going on. And it's just a matter of honoring how we're feeling and then connecting back into something that's going to make us feel a little bit better. So that's a self-responsibility. Now, I'm glad you also mentioned the classes that I teach, because I did see someone asking in the Q&A about how is this accessible, and if it's, you know, if attending a one-on-one session or a coaching journey isn't within your reach, attending a meditation class, attending a yin yoga class, attending any sort of session that's going to make you feel a certain way. If you're trying to get away from this sort of sensation, then you're going to choose a class that's going to make you feel really grounded, really safe, really supported. And a meditation class is a really beautiful place for you to do that. And if you can't get to a studio, the studio that I teach at offers sessions via Zoom, which we started during COVID. So there are options that are more affordable. You don't have to attend a one-on-one session. You don't have to attend in person. I offer lower prices for young women because I want that to be within reach. I also offer packages so that those prices become even cheaper if there's a 3-pack. So yeah, they're the sorts of things that I love to do. I do offer 4 and 12-week mentoring journeys for women, because I see that that's a beautiful accountability experience and it's a beautiful workshop themed journey. However, I think that sometimes a one-on-one session is more than enough for someone to remember who they are and what they have access to within themselves, because we're not doing that work for you. We're simply reminding you what you already know to be true. And I forgot to mention this at the start, but what I normally start with is that anything that any of us say that you go, yes, it only makes sense because you already know it to be true. So that's really empowering. And we as therapists are just here to remind you what you already know.
Oh, there we go. Sorry. I love that. Thank you so much, Kelly. Someone's actually just mentioned that we're talking a lot about our services and what it is that we do and what it is that we provide. I just want to put it out there that this is very much not an advertising platform. We're not here to sell our services to you. What we are here to do is talk about different services, because there are so many different types of mental health support services that cover so many different areas and have so many different approaches. This is supposed to be an educational space for us to understand what those different services offer and what types of people you would usually work with as a service provider. So just to answer like any questions that are coming through regarding that, yeah, by no means are we selling our services to you. We really just want to be in a space to provide you with information about what it is that we do in an insightful way. If you are after specific information about or specific advice from a psychologist, please let us know. Send us through a message if that's what you're after, and we can connect you with someone through the foundation, or we can connect you directly with a psychologist or with someone as well. But Kelly, not to take away from what you said, that was beautiful. Thank you so much. And I've actually witnessed Kelly working with young people, and we've actually worked with young girls together. And we have seen the beautiful things that can happen when you take a preventative approach with young people. And I think that's a little bit with what Kelly does as well, is we know if we're setting young people and young girls up with these tools to be able to move forward in life and to be able to tackle things that might be really difficult for them and not think that the world is against them. You know, that's the goal, is to provide them with a toolkit to be able to move forward in life and not crumble under a challenge. So thank you so much, Kel. And I loved your different take on things, because, you know, as much as the plant medicine and all of the stuff that you do that might be a little bit alternative, as much as it's a little bit new to the scene here, or like new to the popular scene here in WA, it's actually ancient practices. So it's so interesting that now this is all coming to light, and it's so nice how everything's coming back to, you know, what it is that we used to do to calm ourselves, what it is that we used to do to take care of our health and our mental health. So thank you so much, Kel. I am going to get along to Ellie. Welcome, Ellie. Ellie, what I'm gonna get you to do firstly is talk about what it is that you do as a psychologist. So this is going to be different to what we've spoken about, because you do provide somewhat more of a clinical service, and then also potentially touching on what it is that, like what kind of clients are coming to see you, what kind of issues are you dealing with, and then also if you could maybe break down a little bit for people how to access your service, because you know, accessing counselling and accessing holistic services might be different to how you access a psychology service. So take it away, Ellie.
Absolutely. If I miss anything, feel free to prompt me too, because sometimes I go on my own little tangent.
I totally will. I love talking. Yeah.
Before I do get started, I think it's really important that we do talk about mental health being absolutely not one size fits all. So there is a place for a variety of different treatments, practitioners, whether it's holistic or counselling. I'm a firm believer in it's really up to the individual and their needs and their presentations. So what I do as a psychologist is definitely much more on the clinical side of things. So kind of going back to what Gabriella was talking about around that protected title. So to call yourself a psychologist, that is a protected title. So what that means is that any registered psychologist, whether it's a clinical psychologist or a generally registered psychologist, has to undergo a certain level of training. So that can either be a master's degree, or it can also be through practical experience with supervision and continuous education. So So we also have to meet the CPD requirements, and we also have to be approved by the Health Board of Australia as well as the Psych Board of Australia before we can actually jump into practice. So it's quite a rigorous process in terms of, I guess, getting to know all the theory and everything, but also in terms of how we interact with our clients. Speaking for myself, because every psychologist will have a very different approach, I tend to deal a lot with young women, women in general, all across the age span, really. So that's my hotspot that I work in. However, I do think that when we look at what a psychologist does, it's definitely a lot more on the diagnosis kind of assessment side of things. So working with those real clinical disorders that we would see in a diagnostic manual. So that can be anything from depression to anxiety or any of those real clinical presentations. I guess when we talk about accessing those services, it's very different for every mental health practitioner. So for psychologists, because we do have that registered title, a lot of the clients who I will see are referred to me by a GP. So if I am a patient who's experiencing something like anxiety or depression, I'll go and chat to my GP about some of the symptoms and what's going on both mind and body wise, and they will write up something called a mental health care plan. So I'll touch on that in a little bit because that's really important to know about. But more or less, when we talk about these mental health care plans, that is an Australian government initiative by Better Access, which allows a patient to come and see a psychologist and receive a rebate. So the rebate will be different depending on whether you're seeing someone who is clinically specialised or a general psychologist. But we are really typically operating in that kind of clinical side of things. So there is a disorder normally present at that point. That being said, though, I will sometimes see people who do come in for kind of the more preventative type measures. So they're starting to notice that they're feeling a little bit different. They might be feeling off. We have noticed a lot of that with COVID too, with things like just general level of anxiety, health anxiety, and changes to job and security positions. I suppose in terms of what I do specifically, as I said, that will change based on the psychologist that you are seeing. I typically work, as I said, with young women, and I do have my own private practice in Brisbane, Australia. So the therapeutic modalities, I guess, that I work a lot in are acceptance commitment therapy, so a bit of mindfulness and meditation, but also cognitive behavioural therapy. So even though I said I do predominantly work with young women, psychologists will work with a variety of people from different backgrounds. So I have previously worked with, men with traumatic history over the age of 60. So it's not just limited. It's really anyone can access these services. But I want to throw back to Gabriella and see if there's actually any questions specifically, because it is such a broad area in terms of what we're talking about. So I guess in terms of accessing those services, is there anything that you'd like to know specifically there?
I think and I will get around to this in the Q&A side of things, but I think for anyone who's looking to access psychological services for the first time, so say they've never accessed any sort of mental health support before, but they know something is not right, their moods are all over the place, they're really struggling to deal with things. So you spoke about the first step. So would the first step be to go, in order to access a psychologist, obviously, would it be to go see a general practitioner, so go see their GP?
Yes, absolutely. So the first step would be to go see the GP. You don't necessarily have to have that mental health care plan. You will not receive the rebate though. So I would always say if you are experiencing a struggle or some challenges, talking to the GP as a first protocol is always a really great idea. For multiple levels, obviously accessing that service and getting assistance to be put in touch with practitioners, but also in terms of the sense of the support that they can give to, in terms of whether it's the physical symptoms that you're facing or those, I know we have had quite long wait lists in psychology with everything going on, but also in terms of GPs should be able to do some baseline level of counselling, obviously not to the extent of, you know, someone like Gabriella, but they are qualified to do that. So it is, I would recommend the first protocol there. However, as I said, you do not need to see a GP to see a psychologist. It just means you won't receive that rebate. I think it is a really good place to also talk about the fact that even though we are fighting stigma a lot around accessing mental health, there is still quite a lot of fear around seeing a psychologist. And often people who haven't been before don't really know what to expect. And I think from where a lot of psychologists will start, obviously it is quite a structured intake. So we will go through things like family history, mental health history, and a presenting issue for what's going on for you. However, I think it's also really important to give that control back to the client as well and say, you know, if you do not necessarily feel like your psychologist is the right fit for you, that's okay. There are plenty more available. And another great place to start as well is a tool for, if you are looking for that assistance, called the APS Find a Psychologist tool. So it's more or less a service that the Australian Psychological Society provide on the internet for free, where you can put in what you're looking for, where you're looking for it. So if you're looking for a male or female practitioner, an other practitioner, someone who specialises in a specific mental health disorder, early career, late career, you can filter those parameters. So that's also
that's great advice, Elle. And I do think that knowing like that first step to take and like what options there are, like in regards to like either going to see a GP, accessing like someone who you know has been or helped like a friend or a loved one of yours and you want to see them as well. That could be a first step, that you reach out to them. Could be another first step to go through that directory. I'm curious to know as well, just to bring Gabriella into this as well. Gabriella, is there something similar in regards to finding counsellors in your area? Like, is there a directory that you can go through?
Yes, absolutely. So counsellors actually have 2 registration bodies. They're much of a muchness, to be honest. And on each of those websites, there is, for all of us registered counsellors, there is a search listing. So the Australian Counselling Association is one, and the Psychotherapists and Counsellors Federation of Australia, PACFA, is the other. And on both their websites, there's a list of registered counsellors. And while I'm unmuted, I might just add that you don't need a referral to see a counsellor. We don't work on the mental health care plans. Counsellors can't provide rebates under the mental health care plan. And there are some pros and cons. So it's often much more affordable to get the Medicare rebate. But just for people to be aware that that does mean on your record with your GP, there is a mental health diagnosis or some symptoms recorded, which makes you eligible for the plan. And under a mental health care plan, usually two summary letters at different points of your treatment are sent by the psychologist back to your GP. If you go to my GP, there's 4,000 receptionists, probably everyone's reading the letter, you know, so it is something to just be mindful of. It's so much more affordable to get that rebate. But seeing people in private practice as counsellors, we don't have to write summary letters to anybody else. We just have our handwritten notes in our files. But counsellors can't provide Medicare rebates, but as a registered counsellor, we can provide rebates to certain private health insurance companies if you have counselling on your policy, and you may be eligible to access EAP, Employee Assistance Program services, through your employer, either to a psychologist or a counsellor. I believe it just depends on which agency your company is with. So just wanted to add that in there.
No, that's great. That's really useful. Did you want to add something else, Elle?
That's a very quick note on that too as well, because that is 100% right. We do send review letters to your GP. These are often very high level, so treatment goals. So that might be, you know, proactive relaxation, reduction of anxiety. It's not the clinical notes per se. I also noticed a question pop up in the chat, which I wanted to address as well, around the difference between psychiatrists and psychologists as well as counsellors. I think that's a really important one. So psychiatrists are doctors, more or less. So psychiatrists have gone through the same process that a GP or a surgeon would go through. So they've studied medicine, which means that they can prescribe psychotropic medications. So that will be things like Ritalin, antidepressants, anti-anxiety medications. So only psychiatrists can prescribe those medications. If you do come and see a psychologist, even if they are a clinical psychologist, we cannot give you that medication. So we can treat, diagnose, and do the various therapeutic modules that we do, but we can't actually prescribe that medication, which I think is a really important distinction to make, because there can be a bit of confusion around that there as well.
Can I ask a question on that once you've finished?
Yeah, go for it.
So sometimes you can get medication from your GP for like antidepressants. If someone wants medication, should they go to their GP as the first port of call? Do they need a referral to see a psychiatrist, or should they go straight to the psychiatrist for medication? I don't want you to speak out of turn, but I think that would be helpful, because GPs can prescribe some mental health related medication.
So GPs can prescribe medication, and I will disclaim this with I am no medication expert. However, GPs can prescribe psychological medication. I personally, when I work with clients, always recommend that they do see a psychiatrist if they are taking that medication. Psychiatrists have a more comprehensive understanding of both the mental health condition, but also what's involved in that medication. So how it interacts on the body, various side effects and dosage amounts. And that is a more specialized approach than what the GP will normally give in that 15 to 20 minute consult.
That's fantastic. Thank you so much, Ellie. And I do want to get to all the Q&A questions, because we do have quite a lot coming through. I just want to really, really briefly also say that there are also directories that will help you find natural health and like holistic natural health professionals. So one of them, I believe, is like the Natural Health Directory that some people are listed on. Outside of that, usually, Kelly, and you can probably chime in here, I'm not sure if there's any large directory in which you can find holistic counsellors or people that deal with the holistic practitioner side of things. Do you know? Or I think there's one called Natural Pages, but I'm not entirely sure. Kelly, do you know of any directories that?
So I'm not aware in terms of the holistic counselling that I offer. I know that there's a few community groups, Facebook groups that offer those sorts of natural services, but outside of that, I'm not sure. I'm sorry.
Right. No, that's totally fine, because that would have just been interesting to incorporate in there. So before we get into, we'll answer a few of the questions. Before we get into that, I do want to address that there are other types of mental health services outside of the ones that we've just spoken about. I myself am a life coach, so I am I like to think of myself as someone who is your cheerleader and someone who gives you a little bit of a kick in the bum if you need a bit of motivation to work on the stuff that is holding you back. So a life coach, again, is a non-clinical service. You can't necessarily be like referred to a life coach from your GP unless your GP is super into other holistic services and will refer you on, but we're not under any sort of rebate system. We can't necessarily can't claim back a a life coach session on private health insurance, unfortunately. However, this service, I like to think of it as an addition to any clinical service that you do have if you are really requiring that. But the idea behind a life coach is, I like to think of this analogy, and it describes the life coach in the best way that I know how. When you are teaching someone how to ride a bicycle, you don't jump on the bike and ride it for them. What you do is gently guide them by the handlebars while they pedal on the bike. So I am the person gently guiding you by the handlebars. I am not going to tell you what it is that you need to do to make your life better. What I will do is empower you to work through what it is you think would work best for you in order to move forward and overcome challenges. So think of life coaches as cheerleaders and people that will tell you how it is, but also people that will empower you to feel capable and confident and strong. I work with a whole range of people. So I'll work with young people, I'll work with adults, I'll work with men, women, I'll work with trans people. I'm working with a whole range of different individuals, and generally I'll find a lot of my clientele are women that are either going through a big transition in their lives, so either a big breakup, or something big has happened. It might be trauma related, or it might just be big life events that have happened. And they'll usually come to me to get a little bit of normalcy back in their lives, and want to gain control of their emotions and gain control of how they feel about themselves, and really wanting a boost of confidence. So that is, in summary, that is the quickest way I know how to describe what I do. A lot of people don't know what life coaches are. And just to give you an idea as well, there's so many different ways to become a life coach, because we're talking about like accreditations and stuff here, so many different ways, and it's actually very easy to get a life coach accreditation. I'm going to own up to that and say you can go online and do one very easily, do an online life coaching course. But what I have behind me is a psychology degree as well. So I went and studied psychology at Murdoch University and absolutely loved it. Completed 4 years of my psych degree, and then decided that I wanted to cater my services to suit myself better, and not necessarily go down the clinical route. So I decided to move into a service that I felt suited me and felt really authentic to me. So I have a psychology background, and I use that basis to make me a better person when it comes to holding space for other people, a more empathetic listener, and someone that understands a whole range of different psychological disorders a little bit better than others. So either way, life coach is non-clinical kind of service, but is very much still an incredible mental health support. I've got incredible clients that have done beautiful things by coming along to see me and have gained a whole lot of confidence. And there's a million different types of mental health services. This is the whole point of this webinar. There's so many different ways to support yourselves. The idea behind this was for you to understand some of those different ways and then understand how to gain access to them. That was the idea behind this.